Will tariffs affect plastic surgery procedures? The answer may surprise you. So what I'm talking about are actual procedures that are done in the office or actual procedures that are done in an operating room setting. First off is anesthesia. Local anesthesia, sedation anesthesia, general anesthesia do require some pharmaceuticals, and currently, unfortunately, most of them are not made in the US. Most of them are made in China, some are made in India, and if there are tariffs against other countries, we may actually favor certain other countries versus others in terms of the lower cost. So what that means for patients is I believe that there's a potential for an increase in pricing. Having said that, since anesthesia medications are often used in all types of surgery, not just plastic surgery, I do think that the tariffs are going to be pretty low and possibly exempt. Next up are the surgical supplies that I need to do your case. Specifically in the operating room or even in the office, I do need replaceable or disposable things that are typically single use. What I'm really talking about are disposable single use items, including electrocautery tips, gauze, the sterile drapes that we place on you, slippers, other things like that where they are completely disposable, and they've been disposable for a long time. Typically those are predominantly from China, although there are some other suppliers in Mexico, Southeast Asia, and a smattering of other countries. Now I do feel that some of those things may undergo tariffs or may actually have some of the tariffs repealed. The reason why is before Donald Trump became president, Joe Biden actually had an increase in tariffs from 0 to 50% on syringes in August of 2024. There's actually a tariff that's going to increase on other instrumentation in January 1st, 2026, which is well into the future. And Donald Trump in his executive order on April 2nd actually exempted pharmaceuticals from any tariffs. This is knowledge that's really in flux because it's right now, early April. Who knows what's going to happen with tariffs and the negotiations, which countries will actually be able to export items to the United States with low or no tariff, and so on. So this is complete speculation. My guess is that the cost of surgical supplies may go up slightly, but since they're not just used for plastic surgery, they're used in all specialties. And obviously I'm talking about aesthetic as well as reconstructive plastic surgery. The price of the materials for anesthesia, for surgery, for procedures may go up slightly, but I don't think they'll go up that much, only because I do think that until we have different supply chain members, either it's made in the US or we can get it from other countries or multiple countries and have multiple options, I think they're going to keep the price of the surgical disposables, the procedural disposables, and so on pretty low. So there you have it. If you have any other questions about procedures and whether the price will go up or not, this is not meant to either be political, give you bias, or even tell you, hey, let's get that procedure done now before tariffs may go up. To be honest, nobody really knows. And I do think that generically, any administration will want to keep healthcare costs low. So now you know.